Second Class Scout Requirement 6B. Show what to do for hurry cases of stopped breathing, stroke, severe bleeding, and ingested poisoning. Stopped breathing. Check for signs of life. Immediately have someone call 911 or your local emergency number. Put your hands in the correct position in the center of their chest. Give 30 hard chest compressions. For adults, about 2 inches. For children, one-handed, about 2 inches. And for infants, about 1.5 inches with the tips of 3 fingers. If you don't suspect a neck or back injury, tip back their head and open their mouth. If possible, use a rescue barrier over their mouth. Then pinch their nose and blow until their chest rises. Give 2 breaths. Repeat compressions and breaths until medical help arrives. Stroke. A stroke is a blockage or damage in an artery to the brain. Treatment is to get the person to a hospital as quickly as possible, so it is important to know the signs. The signs of a stroke you can see as the acronym FAST, F-A-S-T, face, arm, speech, time. Look at their face. Is it drooping, or is one side not able to move at all? Look at their arm. Do they have weakness in one of their arms, especially the one closest to the heart? Are they having difficulty speaking? If so, if any of these are true, it's time to call 911. Call your emergency number because speed is of the essence. Severe bleeding. Severe bleeding comes from deep cuts. Usually, it is shown by bright red spurting arterial blood. Immediately call 911 or your emergency number. If possible, put on gloves, but speed is very important in severe bleeding. Use a sterile dressing if possible, but if not, use a clean cloth or whatever is available, including your scout neckerchief or a t-shirt. With the palm of your hand, apply firm pressure directly to the area of the wound. If the wound continues to bleed through the first bandage, add a second bandage on top of the first and continue direct pressure. Add a roller bandage or wind gauze over the bandages in order to put pressure on the wound. Be careful not to cut off circulation. When the injury is on an arm or leg, continue checking every few minutes to see that the fingers and toes are not cold or turning blue. If they do, rewrap the bandage slightly looser. You should be able to put 2 fingers between the bandage and the person's skin. Watch for signs of shock and treat as needed. Monitor the bleeding and continue pressure as long as needed. Ingested poisoning. There are 2 kinds of poisoning: swallowed and inhaled. For swallowed poisoning, if you can find the container of the poison, get it quickly and call 1-800-222-1222. This is the Poison Control Helpline, or dial 911. I suggest you get out your cell phone and immediately put the poison control number in your phone. Follow any instructions that Poison Control or 911 gives you. Do not try to give the person anything by mouth unless instructed by medical personnel. If they do vomit, try to save it in a bowl or bag and take it to the hospital with you. This can help. For inhaled poisoning, check the scene before entering. Do not become a second victim. Most inhaled poisoning is going to be from smoke, but sometimes it can be from invisible sources of poison, such as carbon dioxide. Only enter an area after it has been ventilated or if you have protective gear. Move the victim to fresh air as soon as possible. Get medical help. Check for their breathing as often as possible and be prepared to do CPR. This has been Scatter Rob. Like, share, subscribe, and ring that bell so that you can get more great videos just like this one. Don't forget, get with your Scoutmaster in order to get these requirements signed off.